Good morning. My name is Devin Jopp, CEO of American College Health Association. We're pleased today to welcome our guests both in person and online via our live stream for today's symposium. A couple of housekeeping items before we get started. First, we are live streaming the event. Therefore, we'd like to ask our live audience to please keep conversations to a minimum around the cameras in order to ensure a great viewing experience for our online audience. Additionally, we did want to remind our panelists and audience that since it is being recorded, that also all attendees please silence their cell phones. Even better, please don't put your vibrating cell phone on the table to avoid the buzzing effect. Second, we will build in several breaks throughout the time together today. During this time, we will continue the live stream portion of the event, so online attendees are welcome to continue to leave their browsers up or to log out and log back in at appropriate times. A couple of housekeeping items for the folks attending. There are bathrooms out to the left down the hallway and coffee out in the main lobby. Regarding your questions today, since we do have a very busy agenda and packed timelines, we'll have limited time for questions. However, if you'd like to submit a question, please go to slido.com, SLIDO.com, and enter the code MH2017. That's MH2017. You can type in your questions and we'll try to work those into asking our panelists. If we run out of time, we will ask our panelists offline and we'll post up the answers to the questions after the event. With that said, at this point in time, it's my great pleasure to introduce Dr. Michael Huey, who is President of the American College Health Association, Assistant Vice President and Executive Director for Emory University Student Health. Mike, welcome up.
Thank you, Devin. Good morning, and welcome to this ACHA symposium entitled Crisis on Campus, Addressing the Rising Mental Health Demands of Our Nation's Students. It's a pleasure to have you join us today, both here at George Washington University and online, for this series of important discussions. Since its founding nearly 100 years ago, ACHA has been at the forefront of bringing together colleges and universities to help us solve our most pressing collective health and wellness concerns. In 2016, ACHA identified the need to enhance our efforts to address the increasing number of students who are seeking mental health services as one of our top 3 advocacy priorities. The demand for these services has been outstripping the ability of our campuses and universities to deliver this care. In fact, we face the question of whether it is indeed possible for us to counsel our way out of this situation, or whether we need a paradigm shift in the way that we face student health, wellness, and resiliency on our campuses. A seemingly endless series of tragic events on campuses and in adjacent communities only serve to reinforce the need for us to design new, innovative, cooperative, and holistic approaches that enhance campus well-being and build a culture of early student skill building, timely intervention, and connection of students to the resources that they need. As a nation, it's crucial that we come together to help raise the awareness of this mental health crisis, including its connection to alcohol and other drug use and dependence, and ensure that today's students are not only academically successful, but are healthy in body, mind, and spirit. The American College Health Association, in cooperation with the American College Health Foundation, is pleased to collaborate with the leading mental health and higher education organizations on this inaugural symposium. These partners include Active Minds, ACPA, the American Council on Education, the Anxiety and Depression Association of America, the Association for University and College Counseling Center Directors, the Center for Collegiate Mental Health, the George Washington University, the Healthy Minds Network, the JED Foundation, Mental Health America, the Mid-Atlantic College Health Association, NASPA, and NERSA. We are honored to co-host this event with the George Washington University. GW has a long history of supporting student mental health issues and just recently hosted the Active Minds Annual Conference here on this campus. President Thomas LeBlanc sends his regrets for being unable to attend, as today is his inauguration as George Washington University's 17th president. However, we are honored that he has sent us a brief video that we would like to share now.
Good morning. On behalf of the students, faculty, and staff of the George Washington University, welcome to today's symposium, Crisis on Campus, Addressing the Rising Mental Health Demands of Our Nation's Students. I regret not being with you in person today, as my inauguration as GW's 17th president is also occurring this morning. We're honored to host you at GW and to serve as a convening point for this symposium, along with the American College Health Association and other leading mental health and higher education organizations. I'm pleased all of you are dedicating your time and energy to this important discussion, as supporting the mental health needs and indeed the overall well-being of our students is a fundamental commitment all of us share. This commitment starts on our campuses, classrooms, laboratories, residence halls, playing fields, and especially in the health center while our students are with us. But the commitment must also include a view well beyond graduation, as we help prepare our students for lives beyond our campuses. Addressing the mental health needs of our students is complicated and requires holistic and comprehensive services that are both affordable and accessible, which is no easy task. It requires a multifaceted, interdisciplinary approach that involves every aspect of our institutions. This approach, of course, begins with the provision of counseling services, but must also include partnerships with faculty and staff colleagues and student services departments, psychiatric and medical services, robust behavioral intervention teams, integrated case management, and outreach, education, and prevention. And increasingly, it must also include programs to support students who are coping with substance use disorders and those in recovery. As you know, this is an enormous, demanding task and one that requires the commitment of all within and beyond higher education. This symposium provides the opportunity for all of us to learn from each other, our collective expertise, experiences, and perspectives. Together, we can ensure our institutions are prepared to address these demands and create a systemic, innovative, and embedded culture of providing our students with the fundamental support they need and deserve. Thank you.
We are very fortunate today to have a lineup of talented and passionate panelists. Our goal is to give a 360-degree view of the mental health challenges we face on our campuses, to identify new innovations in both population-level well-being and mental health service delivery, and to call upon our national, state, and local legislators and thought leaders to design policies that support innovation, foster research on prevention and intervention, and build a culture of student mental health and well-being. At this time, it's my pleasure to introduce our first panel, which is made up of college presidents and chancellors in a session entitled A View from the Top, the Real Impact of Mental Health Crises on Campus. Joining us today for our President and Chancellor panel is Dr. Andrea Chapdelaine, president of Hood College in Frederick, Maryland. Dr. Chapdelaine was sworn in 2015 after 20 years of work in higher education, mostly at Albright College in Pennsylvania, where she served as provost, chief academic officer, dean of undergraduate studies, and on the psychology faculty staff. Welcome, Dr. Chapdelaine. Our next panelist is Dr. Ronald Nowacek, president of Frostburg State University in Frostburg, Maryland. Dr. Nowacek has more than 35 years of higher education experience. Before his recent inauguration, he was the provost and vice president for academic affairs at Pennsylvania's Clarion University. He also served as the dean of the College of Arts and Sciences at the University of New Haven, associate vice chancellor for economic and community development at East Carolina University, and chair of ECU's Department of Psychology. Dr. Troy Paino is the president of University of Mary Washington in Fredericksburg, Virginia, a position he began in 2016. Prior to his arrival at Mary Washington, Dr. Paino served for 6 years as president of Truman State University in Kirksville, Missouri. Previously, he was Truman State's provost and vice president for academic affairs. He also served as dean of Winona State University College of Liberal Arts. Dr. Venkat Reddy is the chancellor of the University of Colorado at Colorado Springs, as well as professor of finance. He has served at UCCS for 25 years, where he was previously dean of the College of Business and the associate vice chancellor for online education and initiatives. Presidents Chapdelaine, Nowacek, Paino, and Chancellor Reddy, thank you for joining us this morning. Recently, a survey of college presidents indicated that mental health is one of the top concerns of our college presidents today. From your position, why is that? And what does this look like from your perspective on your campuses?
I'm on the left, I guess I'll start. I'll add, I think the biggest thing is student demand. We're seeing, from my perspective, I think, and this is something that presidents are sharing, the number of students that are asking for the service of mental health counseling is just expanded, grown exponentially. So that aspect of student demand, I think, is really what's driving it for many of the presidents. Also, the importance of having students who are mentally healthy, I think, is also very critical. When we have a problem with a student, it can be catastrophic, and that is a big concern for many of us, at least for me.
Yeah, I would agree. I think the mental health issues that we're confronting is interfering with us achieving our core mission. Obviously, we're here to educate, prepare our students, get them across the finish line, and we recognize that in order to do that, we have to create safe environments. We need to make sure that the students are prepared to meet the rigors of academic life, but also life after graduation. And I think we've all recognized that the mental health issues that our students are facing is just a big obstacle in us achieving those goals. And quite honestly, as presidents, we also have to think of the pragmatics, and that this is certainly a huge resource drain for our institution. Resources that could be devoted to other things that could help our students be successful, whether it's in the academic or social life or what have you. And so I think both in terms of it being an obstacle for our students' success, it's also an obstacle for us from a financial standpoint.
I would certainly echo what the other president said. I think the only thing I would add to that is also there is a greater expectation, I think, for the services from families as they're bringing their students to us. So meeting that expectation, reassuring the parents is very difficult because, as was said, meeting that demand as it continues to grow. And as we know, not just on campus, but in our nation, our resources are very stretched in this area. It's very difficult to meet that that expectation. And so I think that not only for the well-being of that student, but for the entire community, and helping support our faculty and staff as they deal with these students and help support them, I think is one of the reasons why it's a primary concern for all of us.
Well, a lot has been said, so I'm just going to add a couple of things. One is this is really a silent epidemic that's taking over the campuses, and we have not really given it enough attention. And as presidents and chancellors, we talk about enrollment, retention, graduation rates. And think about it, this is something that's happening behind the scenes, and if we don't understand it and comprehend it, we're going to pay a pretty heavy price in the long run. So I do hope that this will become a very strategic initiative for the campuses, because tuitions are going up. We can't afford the students to be coming in and not be able to help them and accomplish what we intend to, which is keep them in college, help them graduate, and create successful lives and careers for them. And so this is a very, very critical issue that we are very concerned about.
From an institutional perspective, what have you seen regarding the change in the need for mental health services on your campus? How have things evolved over time? And from your position, what seems to be driving the increasing needs on your campus and if appropriate, across the spectrum? And we'll start with Chancellor Reddy so that we'll just go up and down the line, up and down the line. Every now and then I'll throw in a few words just because they brought me all the way from Atlanta.
Well, one of the things we have seen is almost a 50% increase in these instances even in the last few years. And as a campus, we've been adding almost at the rate of one counselor every year for the last 8 years. So we already increased the number of counselors, but it never seems to be enough. Our university is kind of unique because we almost have 20% military population. That means we also have a lot of PTSD issues coming in. That makes it really tough. And we are doing as much as possible to catch up. And we have faculty engaged in the process. We have research centers. But I still think it's going to be a bigger challenge. I don't think we have enough resources to address all the problems that these issues are going to bring. So we have to address this as a campus community as a whole, and not by having a few counselors, even though they're doing a tremendous job.
As we talked about earlier, even when you think maybe you have enough counselors, you run out of rooms. And when you run out of rooms, then it feels like you need more counselors. And it's a growing and growing and growing process.
Absolutely.
I think the other thing is what we've seen is a significant increase also in the number of students needing medication management, and that brings a whole other spectrum to the counseling services that we didn't see, say, a decade or even 20 years ago. So not only having counselors with expertise in particular areas of mental health challenges that students typically encounter, but also how to get the appropriate care from a doctor to provide oversight of that medication and monitoring it. As we know, many students take college as an opportunity to rethink that protocol, and often without looking towards the people who have been treating them for advice on those decisions. So really helping the students understand the implications of medication and changes in medication has been a really difficult one. Again, because even if you can create all the resources to bring that expertise to campus, it's not always readily available. So that makes it very difficult. I also have seen an increased demand or expectation of staff support and faculty support, because many of these issues, frankly, they're not trained to deal with, and the students are coming to them, and how to help the students navigate their way to the help that they need has also been something that has frankly often outstripped our resources to respond as timely as we would like to.
So in the interest of full disclosure, I guess I'm sitting up here in two different roles. One is this is my second presidency, so I've seen this kind of evolving and growing, this issue, since my first presidency that started in the spring of 2010. But I'm also a parent, as many others here I'm sure are as well, and I have a 20-year-old daughter and a 17-year-old daughter. And so in many respects, I've seen this issue kind of bubbling up very close and personally at home, not just in my role as president. And I don't think my daughter, who's a junior in college, would mind me saying this, because she is an advocate for mental health on her own campus, but she is diagnosed with generalized anxiety disorder and OCD, and so she is very typical of many of the college students that we see today. So I've watched this firsthand grow, and so it's been kind of a wave, and it's been a wave that kept getting bigger and bigger, and I think as was said earlier, our initial response has been to focus on counseling and to continue to try and meet the needs, the growing needs of counseling, and all of our institutions have added counselors as we can afford it, and we've made it a priority. We've grown, many of our counseling centers. Mary Washington is a school of about 4,300 undergrad, 4,800 if you include grad, but most of the students who access our counseling services are undergrad. We have 6 full-time counselors now in the counseling center, as already been mentioned. The demand for it is insatiable, and the growth has been pretty exponential, and I asked for some data from our director of counseling, and it probably mirrors many of the data points that you look at your institutions in terms of the growth, and even just over the last 3 or 4 years. I mean, it's been steadily growing, but I think we have hit a tipping point. And a lot of this, I think, does have to do with the students today, and my daughter certainly would be one of them, who has had prior counseling before they ever arrived on our campuses. So they come already prepared to access those services and expect to have those services for them. Of the students who are seeking counseling at Mary Washington, 75% of them have come with prior counseling before they ever arrive. 50% of them are already on medication before they ever arrive on our campus. So these are students who have been educated in terms of their own issues and how to try to manage whatever challenges that they're personally facing. So I think we have hit a point, not only at Mary Washington, but in higher education, where we recognize that just merely counseling is not going to be enough to solve this problem. It's very reactive, and we know that we have to be much more proactive and much more holistic in our approach to wellness. And so I'll just mention very quickly, and we can talk about these things later, but at Mary Washington, one of the first things that I did is put together a commission that is looking at trying to create a more sort of holistic wellness initiative on campus that focuses on certainly physical, emotional, mental, spiritual well-being. And so they're going to be coming at the end of this year with recommendations on proactive things that we can be doing. But there are other things that certainly we already are doing, and that is including we have a contemplative studies minor, and certainly creating spaces for meditation, and trying to also, I think it's important to think about how we're training our faculty and staff. We focus oftentimes narrowly on the counselors to be our saviors for all of our problems. Send them to the counseling center, and let's hope that that takes care of it. But we know that that's not going to solve it, and so we have to really prepare faculty, many of whom have been teaching our institutions 20, 25, 30 years. They're beyond their, just like presidents. We're beyond our depth here, and we need training. Presidents need training on this, and oftentimes our boards look to us as the ones with all the answers, but I'll be honest with you, in part the reason why I accepted this invitation is that I'm here to learn as well, because we have a lot to learn in this area.
I want to second what Troy mentioned there too about us learning as we go through this. I think the comments that have been made really do speak to the fact that 25, 30 years ago there was a stigma that, okay, if you went for mental health, there was an issue that you didn't want other people to know. And you were very quiet about where you went and so forth. And I think what we've heard here, and I think I concur with it because I see it on my campus too, a lot of students are coming in having had counseling, having had medications. I find it interesting when I talk to people in public and I talk about the percentage of students that are on medication. There's a surprise, there's an initial surprise from people going, what, that many people, that many students are on medication? And then they sit back for a second and they say, well, I'm not surprised. But it's making that awareness. And I certainly know, we were talking earlier, certainly the case with boards of trustees, that part of our role, I think, is educating and helping with that awareness. I don't know of a campus that doesn't have a waiting list for students to see a counselor. And I think, too, what you've heard here is there are different levels of needs of students. And there are those, certainly I think coming in the first year where many of them are not sure should they be there, areas of just needing some help. And I think the comments about doing things proactively, working on wellness to help some of those students before they need counseling and providing the support kinds of things, I think are really critical.
And we talked about this earlier, that it can be challenging and intimidating for faculty and staff and our student affairs colleagues to say, you know what, this seems like a student that's just lonely. And let me work with this student and help her know what kinds of opportunities we have on campus for students to interact with each other, not over an electronic device, but together in person with students who share their interests. And being overwhelmed is not being mentally ill, but it's something that students need help with. And so how can we figure out more comprehensive ways to do that? And it's a challenge, but it's not just a challenge in terms of putting together the resources. It's a challenge in terms of all of us on the campus being comfortable in recognizing when students are in distress and when they're truly facing a mental health crisis, and differentiating those two. As president and chancellor of a college, how do you stay current? How do you share information? How have you become increasingly comfortable over time with the face of mental health issues on your campus and across the country?
Well, we start
Yes.
here for change.
We'll start in the middle,
I guess I'll
and then
start.
we'll run this way. Yeah. Those of you who have future panels, pay attention, because there's going to be a test afterwards.
Well, for me, as I said earlier, when you have a daughter who is struggling with many of these issues, as a parent, you begin to educate yourself. And so even well before I became the president of the university, my wife and I were busy reading, and certainly as we sought help for our daughter, tried to learn as much as we could. But as president, we rely on the experts on our campuses. Usually you have a cabinet member who directly reports to you, and for me in the form of a vice president for student affairs. And certainly this is a topic of every one-on-one meeting that I have with my vice president of student affairs. And certainly our director of counseling is constantly reporting to her, our dean of students as well. And if you are like Mary Washington, you have a board that's very engaged and interested in this topic as well. So we have a lot of time with the board and with our academic and student affairs committee of our board where we discuss these issues, where we bring in our director of counseling and we talk about the trends that we're seeing, our response, and what are best practices and what they're learning from organizations such as this. So that's how I keep abreast.
I would add to that, we have what I would call our risk management team, who is comprised of the people who work most directly with our students, and I make sure that team reports to the senior administration, to my cabinet, and myself on a regular basis, so that we can hear directly from their perspective, in addition to obviously maintaining close communication on this issue with my vice president for student affairs. The other thing that I found has been very invaluable is to talk to the students themselves. And I don't mean in terms of one-on-one counseling, but just to have general and make sure that the students feel comfortable talking to me about what's going on campus, because it really does give you a sense of their perspective. So when they experience a roommate or a friend that seems to be struggling, that you can become aware to the extent that they felt the services were known to them, they knew how to refer and support. And I especially find our resident assistants are the ones who seem to really have that pulse of what's going on campus and where students perhaps are being challenged to get access to the services that they need. And so I find that having that dialogue directly with the students as much as possible, of course it's difficult, but really does help, because it can reaffirm or at least open up new conversations for the staff and the faculty to have about what's experiencing. And again, not surprisingly, I'm sure to all of you, the faculty as well seem to be the ones that students often will come to first. And so making sure that they know who they should be talking to and inferring that information has been very important for me to better understand what's going on campus, as well as, of course, reaching out to organizations such as those sponsoring today and making sure that I'm paying attention to what's going on in terms of national trends as well.
Well, I've been appointed chancellor this year, so I'm on a kind of a speed learning curve, if you will. So I think this is one of the best things that happened to me, being invited to the Mental Health Symposium. I want to give out a shout out to Stephanie Hannenberg and Benek Otelia here, because I rely on my team. I don't claim to be an expert in it, but really having some great people who really care a lot about the students and building that community on the campus is so critical. So I'm going to say I'm going to rely on them for quite a bit longer before I get educated. But opportunities like this help you bring that awareness to the office. So my hope is take this back, make sure that our vice chancellors are also aware of the critical nature of mental health. And you'll see me learning a lot more, continuing to read up, stay sharp on the media. So I look at this as a learning experience, but I have to tell you, I do rely on my team. So surrounding yourself with the people who care a lot about this issue, I think is the most critical thing I can do.
I'll echo all of that and just say that for my campus, we have a very good team of vice presidents. My VP for Student Affairs is obviously the point person for much of the information that's being provided, not only about what we're doing, but about the nature of the students coming in and the issues that they're facing. But it's on our agenda, it's on a regular basis, and it's one of those things, as I tell our team, everybody has to be empowered on it. We talk about faculty, but I found very early on, I've been president now for 18 months, early on I found out about the importance of the housekeepers in the residence halls. They, in many cases, almost serve as house mothers. And talking with them, I had to talk to my VP for Administration and Finance and said, make sure that the housekeepers have a way of getting that information to the RAs or to you or to their supervisor, because it takes more than just the faculty. And again, we can get into this, because there's a lot of issues for the faculty these days. They're getting reporting requirements. They're being asked to deal with issues that many of us have never been trained for. And how do you handle that? It's the same thing for the housekeepers. And so what we're finding is the students in their housing residence life, looking at that. The big challenge for me is, what about the students who are off campus? And how do we deal with those students? Because the assumption is that just because they may be juniors or seniors, they're in better shape on things is not the case.
One of the things that I love about college health and wellness, and I think just colleges and universities in general, is how we share with each other and how we're not proprietary in the things that we're doing to help students grow and succeed and stay healthy. And I hadn't thought of the housekeepers before Dr. Nowacek brought it up this morning, but you know, the people who are there on the ground, we always talk about our RAs as being the public health officers of our university for our newest undergraduates, because they're right there and they're seeing what's happening. And they're going to see the student who's in distress, the student who's sitting alone crying in the stairwell, the students who are clearly having issues with substances, and they can bring that safety net in that's so important. Dr. Chapdelaine, you talked about working with students and using students for you to get a pulse of what's going on campus. And so I'll come back to you. What do you see is that ideal partnership between students and administration? Is it through student leaders? Is it more of just kind of connecting with individual students? How do you build that understanding and partnership on the campus?
Well, I think you have to begin from more of a systematic approach in saying, where are all the points of opportunity to educate the students on what resources are available, what are some of the challenges you'll be facing. So, of course, like I'm sure all of the schools represented here, our RAs go through extensive training even prior to students stepping on campus. So our students, through the orientation process, are educated on the services that are available to them, and also told how to give feedback if they're facing those challenges. So to me, that partnership has to begin really at the point of admission, and letting them know that we are here to support them and provide them services, but also, as President LeBlanc was saying in his opening comments, helping them understand this is a pathway to a lifetime of wellness, and that although we are here to give them resources and support them, we're also to help them take their next step after graduation, and how do we set them up for a lifetime of managing whatever mental health challenges they're facing so that they can do well, not just while they're at college, but beyond that. And I think sending that message both of support and empowerment sets up the ideal partnership, because the students understand better their role in this path as well. And I also think it's incumbent that they are reassured that we are committed to providing the training and the education to all the people that they interact with on the campus, and making sure that those people will provide the effective support that is needed. So I think that then allows for that more one-on-one conversations that can happen in all the places that we talked about, and the students feel comfortable speaking up when they need to.
Chancellor Reddy.
Well, obviously, this is a very complicated issue. So this is not the only thing we talk about when you talk about students, right? We talk about their performance in the classroom. We talk about the issues with millennials. We talk about financial aid issues. We talk about how do we help them with homework. So you can't just isolate one and say, okay, we're going to deal with this. So it's really a compendium of issues. So when you're working with this, you have to figure out a way to build that culture of inclusion, where students don't feel like having a mental issue is a problem with them. I think that's the bigger leap we need to make, not just from a student perspective, but a faculty perspective, staff, administration, that accept that just like we get physical ailments, you also get mental ailments. That should not make you somehow separated from the rest. But when we can build that culture on a campus of inclusion, saying, hey, just because you have this doesn't make you some way strange, but that's just part of life, and we are here to help you. So make it much more inclusive for them so that they can seek help. We even have programs like Starfish to identify students at risk. So the sooner we identify that, we had to think about, is that happening because the student is lazy, or do they have a mental issue? So I think that'll help us start identifying those. But the most important thing is to make sure we feel the students, we're here for you. I think that's the biggest signal we can send, and that can happen only we can build that culture. That means we need training at the chancellor president levels, at the vice chancellor's level, the faculty level, and the staff level, that this is something that we all need to work on together.
We have so many interesting questions, and I'm going to start dividing them up a little bit more as we go ahead. And so, Dr. Nowacek, as president of a college and university, how do you help facilitate access of students to mental health service? You said earlier that you didn't know of a campus where there wasn't a waiting list. And so you have a waiting list on your campus. What's your role in helping that?
I think the thing for us is, again, we can provide resources. That's our role, one of the roles of the president. And I really think there is timeliness and effectiveness. I mean, there's got to be accountability. We need to have the data. Everything now on campuses is so data-driven. We need to be getting information, much like Troy, you were giving out the data of how things are changing. We need to have that view of what's happening on campus, and really looking at effectiveness and timeliness are the two main things that at least from my perspective, I'm looking at. We're actually, in fact, right now, designing a new counseling center. And so part of the discussion in preparing for this has got me thinking about already, how much more room do we need that we don't need today, but we're going to need 2 or 3 years from now, that I should be planning on adding into it. The other comment I'll just quickly make is that I think the other role I think is very important is to empower people on campus. And by that, I do formally, when I meet with the student leadership and the staff and faculty leadership along with my executive cabinet, make sure that we have this topic on there on a regular basis so that people can talk about it, people can bring their issues forward. But the other is so that the students know that it's important. Now, in my mind, I meet monthly in different residence halls, have an evening without an agenda. Typically what comes up is food. That will be one of the topics they'll bring up. Sometimes parking, depending on the time of the year. But one of the things that I do ask them about is counseling. And I say, what do you know? How are things going? Those, making that effort to go out and say it's on my mind gets around campus quickly. And I think it's really important because then they're looking for that leadership to say, is somebody paying attention? And so I think that, from my perspective, is something we always have to keep in the back of our minds.
Dr. Paino, role of the president in access.
Yeah, well, so if you are president of a smaller school, oftentimes you do that by choice. And I've been the president of 2 relatively small public universities with liberal arts missions. And the reason I choose to work at a place like that is that I like students. And so I like interacting with students. And I think the larger the institution, if you had different presidents up here, the type of institution really defines your role and what you do with students. But fortunately, at the institutions where I've been president, I do have direct access with those students and do it very intentionally, having them over for dinner, going out on campus. I always tell my office that privileged students, if they want me at an event, sorry faculty, but students, are even above faculty in terms of their priority in my scheduling. And so I think the first step is mutual respect and a willingness to listen. But one thing I will say is, because I think we all do everything we can to make them aware of resources, and I've certainly pushed back in terms of our counseling center to think creatively, because again, I just don't think we can counsel our way out of this problem, and so we have to think differently about how we support these students. But I also, it's been interesting. I'm a former lawyer and a historian, so I'm really beyond my depth here. This is not my area of expertise. But as a historian, I do think about change over time, and I sometimes make mistakes just like everyone else in terms of creating analogies or comparisons to earlier times. And sometimes people compared what we're going through now to the 1960s. I think there's something fundamentally different between the students today and the students of the 1960s. Back in the 1960s, they challenged authority and even didn't trust authority. In some ways, the students I interact with maybe expect too much of authority. They expect presidents and vice presidents for student affairs and even counselors to somehow have the magic bullet or to be able to solve their problem for them in some way. So I think one of the most important things that a president can do through that mutual respect and listening is also make them aware of their own agency. And how they could maybe be a little bit more proactive in solving some of their problems as well, certainly in a nurturing, supportive environment, to be sure. But that is something that I think is important for presidents to model.
And you couldn't have teed up the next question any better. I actually was one of those students in the 1960s, I'm embarrassed to say, but I don't remember really challenging authority that much. Maybe I have to make up for that now by doing it. But Chancellor Reddy, we've talked about not being able to counsel our way out of this situation. And of course, it's critically important that we have as many resources as are possible, given all of the priorities of the university. But how do we, as colleges and universities, and you as presidents and chancellors, help to look at the upstream issues and reach out to try to do things to help mitigate these processes, these problems that we're going through downstream? How do we help our students in the high schools that are feeding us to be better prepared, better balanced in terms of their health and wellness? And to what degree are we even capable of affecting those upstream issues from the positions where you sit?
Well, we already came to an agreement that we can't have enough counselors on a campus to take care of the issue. Nor do we have the resources to support more counselors. And even if we bring more, we don't have the room to put them in either. So we have a series of challenges, even with resources or without resources. So what we have done on our campus is created something called the Gateway Guides program. So these are graduate students in counseling who offer 3 90-minute sessions to freshmen. So at least they're getting that, so that takes away some of the burden from the counselors to start with. And we could start thinking creatively about how we expand a program like that. How do you kind of create that peer system? We also created a helping your student transition to life as a college student, a guide that we give to all the parents so that they can be prepared saying, okay, this is what the transition is, because it's a very stressful thing. I have 2 kids who, one finished college, one is on the final year. It's a pretty stressful thing for parents to leave their kids at college and say, and they really trust us, which is amazing. I mean, they just say, oh, the colleges will take care of my student. And so we really earn the trust of the parents, so we need to respect that and provide that guidance. We also have done, what we did is we really created a holistic approach to this. So we brought together the health and wellness and mental health folks together and created one team. If you can't tell, I'm from India originally, so it's one of the big things about India, I want to just kind of take a little sidetrack here, is looking at the world from inside out versus outside in. So there's a huge connection with that mind-body connection. So when we bring those together, and we experience that, if you can make time for fitness, your mind feels better about that. And if you can help give fitness to your mind, your body feels better about that. So we need to figure out those kinds of ways to say, how do you bring that mind-body connection? And as Troy was talking, it looks like he's already implemented a few of those. I think we need to start exploring new ways of thinking about this and not just kind of think about medications are going to solve the problem. So I'm looking forward to really thinking about this more deeply and expanding issues beyond that.
It's a challenge to balance it, though, isn't it?
Absolutely.
When do you know that you have the right amount of mental health services? When do you know that you have the right amount of prevention and wellness services? Mm-hmm. I'm sure you're weighing those scales all the time. Mm-hmm. President Chapdelaine, talk about upstream issues and the balance between prevention and treatment.
Well, I think as presidents, and I would say more broadly, as institutions of higher education, one of the most important things we can do is to think about how our education can provide those services into the future. So we have had a very long history of a very strong social work program at my institution, and we are proud to say we started a master's in counseling program a few years ago. A few of the faculty are with us this morning. So I think it's important for all of us to look, as a psychology faculty member, I certainly have been thinking about preparing students to help address future students' needs. So I think we need to be looking at our own curriculum and saying, in our teacher preparation programs, as those students are going into the elementary, middle, and high schools, are we talking about these issues? They may not be on the standardized assessment for their certification, but they're certainly important for them to understand how these issues will impact the students in their classroom. So I think that's part of the holistic perspective, is going back to our fundamental mission to educate. And so if this is, and I would agree, a national epidemic, and we are clearly not meeting the needs in a proactive way, we should use the power of our educational vehicles to help address that. And then the second thing I would say in upstream is that community approach. We will not solve this problem alone. So when I looked around and saw very quickly that my ability to provide the resources on campus that my students needed was not going to be sufficient, I looked to the community partners, and I looked to the local hospital. I looked to the K-12 system, our mental health agency, and so forth, and brought those groups together. And I really have to give kudos to my counseling staff, who have been so proactive and innovative of thinking of how can we create a network of care that can serve our students. So I think this is where I think today's symposium is wonderful in terms of a learning tool. How do we innovate together to address these issues? We have to not think about this in isolation anymore, but how through consortia and shared services can we not only support our students, but our community as a whole, because as we know, the effects of these challenges do not stand in isolation to each other.
And we've heard already, without even asking the following question, about innovations on your individual campuses and the sorts of things that you're doing. Maybe that you originated, maybe that another college or university that you know originated, but and we won't go in any specific order, but here's an opportunity to say, you know what, we're doing this on our campus, seems to be helping. What kind of innovative things have you seen, and if not on your campus, in your systems or in sister institutions, that you think, hey, this seems promising to me?
I want to follow up answering that in that,
Absolutely.
we have a master's in counseling, but we just got permission from the state to create a nurse practitioner position or a model with the specialty in mental health psychiatric. Now, we're in a rural part of the state, in western Maryland, where, like many parts of rural parts of the country, are dealing with opioid issues. I had the fortune to take the governor on a tour through my building, one of my buildings last year, and I mentioned that we were doing a nurse practitioner. And I said, well, we're putting a program in, and I said, one's going to be family practice, and the other one was behavioral mental health. He stopped and looked at me, and he said, tell me more about it. So I know when I got the governor's attention, this is the right thing. But again, for us, what we found in the rural area, we need help, especially with the psychiatric side of things. We don't have the community support. I mean, we just don't have the individuals there in rural Western Maryland to provide that kind of help. We're moving to this nurse practitioner model, which is going to be, I hope, will be a very good one because they're going to get clinical experience being on the campus working. But the other thing I want to add too is that what we've been doing is doing more group therapy kinds of things. Students seem to be comfortable with that. We're seeing people saying that we've got counselors that are saying, let's bring people together in terms of groups to work on it. I had a transgender student approach me about a month ago asking about support groups. And so we've had a reputation on campus of being, if you have 3 or 4 students who want to start a group or a club, go ahead and do it. Support groups are a little bit different. And so we said, okay, let's approach this in a way that I've asked the VP for Student Affairs to say, how can we make that work? So we're seeing more of bringing individuals together as an approach to help to go beyond just those individual counseling sessions.
And so many of those upstream needs that students have really work very well in a group setting with other students who are dealing with loss, whether that be loss of a family member through death or loss of relationships, students who are coming to terms with their identity. All of those sorts of groups are so beneficial, and they take away the need for each one of those 6, 8, 10 people to have a visit at the counseling center every week. So absolutely.
I'd like to just mention very quickly 2 innovative things that I have seen in my career, not all necessarily at my current institution. One is exploration of the EAP we provide for our employees, and whether there could be an expansion of those services available to our students, and that worked very effectively. And then again, second, very quickly, when I talked about partnership and shared services, one of the institutions I worked with partnered with the local hospital to provide all the counseling services. But what that allowed is 24/7. It also allowed for expertise. So some of those counselors were trained in anxiety issues or trained in issues of eating disorders, the types of things that students, so you could sort of wrap the services and individualize them more than if you have one counselor working 40 hours a week who has been there and has been trained in one particular area, because of course no one person could be an expert on all the issues students face. Now I know for people in rural areas that can be much more challenging, but I just offer those as possibilities.
Funding. We'll go on to the next question. Anytime we're talking about health and wellness issues on our campus, funding is central to those discussions. And I know that none of you have any magic hiding there in your microphone. But can you talk about how you juggle funding issues and all those other spending priorities on your campus? And to what degree can campuses be flexible? Things happen in the middle of a year which prevents a crisis across the campus. Maybe you've had some sort of really tragic episode on your campus, like at UVA or the concert in Las Vegas and the effect on so many of our campuses there. So something happens and you have a short-term need or maybe a long-term need as a result. How do you balance those things? Where do you find funding when new things come up? And if so, could you write it down and I'll take it with me back to my campus, as will all the rest of us.
Well, let me take a shot at that. So we do have a pretty open process. We have the budget review process where different department comes and they kind of make a claim for, hey, these are the needs we have. You can't just make one area a priority and say that's going to get the funding, but everybody gets to make a case. That's how we were able to increase the number of counselors on our campus. When Clinic started, there were 1 person, and now we have 9 total. So every year over the last 9 years, we kept adding. That means they made a really good case, and it shows the need for it. So we did increase the funding for it. When you ask about one-time funding, we are a campus of 12,500 students today. So you always have to keep some in the reserves to take care of this funding when these sudden things happen. My bigger challenge as I see into the future of higher education is the free speech movement that has taken over. And I always say, hey, I'm all for free speech. I want the left speakers, the right speakers, and come talk to us, but I can't afford free speech in terms of security and the cost it takes to bring the speakers on campus. I would rather give that money for scholarships. So you're going to have these special instances that are going to happen, and you have to figure it out. And this is no different in that sense, that you have to provide it. This is more funding as well as innovative way of doing it. Our Director of Mental Health is really working on a Train the Trainer program. That means, how do you prepare others? How can you help faculty see that some student is at risk, and so they can kind of go and help those people? So you can stretch the dollars as well by being a little bit more creative and innovative, and really expand the services by including other people in the process.
Yeah, well, I agree with all of that. Something a little bit more mundane. I think each school probably funds their services in different ways, and you have to think about sort of revenue. But just a problem that we had that goes to sort of helping teach responsibility is that with the backlog and the demand for counseling, we were running into a problem with students who made appointments and that didn't show up, and which creates problems for not only our counselors but other students who desperately need those services. So what we're implementing is a fee for those who do not give us 24-hour notice if they don't show up for their counseling session. It's not a punitive fee. It's fairly minor, and it's not going to help solve our revenue problem to support this work. But I think it does send a message to those students that if you schedule appointments, that's people's time, which is a drain on our resources if our counselors are not being used effectively, and certainly it also affects other students who desperately need those services.
And then in our final 2 minutes, I'll give a very easy topic for you that you can wrap up quickly. Board of Trustees and Board of Regents. That's simple. So in the next 90 seconds, if all of you could comment on the approach to working with your boards of trustees and making sure that they understand about mental health and preventive needs. And I guess one of you gets to take the final word on that. So it's up to you.
I'll start and let somebody else have the final word. 2 quick things. One is awareness. I just continually find the board needs to be made aware of what we're dealing with on campus and how important it is. The second, and we're fortunate, Board of Regents in Maryland, one of the regents is an MD, and she has become the advocate for that among the regents. So I would encourage presidents who are working with the boards to find an advocate on that board to make it work.
So I've had 2 different boards, one at Truman, one at Mary Washington now, And I just don't think you're going to find a collection of members who haven't had direct interaction with this issue. And so the interest is there. They want to know about it. I have 2 board members right now who've lost children to suicide. So you don't think that they care deeply about this issue. They want to know. They're fully engaged. So this is something that they're asking even before we have a chance to present, quite honestly.
2 things. I think presenting them with the data so they understand the demand and the stress on the system that we're facing. So making sure that that's part of the dashboard that my board receives at every board meeting, kind of number of visits, number of students who withdraw for mental health issues. And if they weren't aware, those numbers really get their attention. And the second, the board just recently kind of restructured some of their committees to focus more on risk campus-wide. And this clearly was the #1 topic as part of the risk that they wanted to look at. You know, they're always very focused on financial risk and those types of things, but they said really we need to be looking much more holistically at this issue. And I think that's wonderful because it will bring not only the health and the student affairs side together, but across all the areas that the board's responsible. And I think I'm happy for that increased attention because I think, you know, these are problems that we need our boards to help us deal with and help solve.
Well, I agree. I mean, the awareness is the most important thing to do. And we talked about board being interested in the financial risk. This is a financial risk. So when you educate the board, when they talk about we need to increase retention and graduation rates, we can educate them from that side also if they don't understand from the purely mental health side. But I do assume good intentions. They want to do the right thing, the board members. So I keep preaching about we all need to work on this as one team because at the end of the day, our goal is to help students succeed. And if we don't address this issue, we are failing on that issue. So I think educating the board, just like we're educating ourselves, I think is important, but also put that in perspective that the implications are not just on the student, but it's on the family of the student, the campus, the community. It's a much, much broader issue rather than just one person being affected by it.
Mike, we actually have one question that came in online. If you could throw that out there unsolicited. Somebody online asked, why is providing essential mental health resources considered a resource drain when academic initiatives are characterized as investments?
Well, I think that's a great question because I think that everything is an expenditure of some sort, but I do think the way of looking at this is an investment in mental health helps our students be successful, and it connects to all the other goals that we talk about, retention and graduation. You can't be successful if students aren't able to meet the challenges of their day-to-day lives. So no, I do think it's an investment. I think the reason why it's probably different is that there's not a direct revenue stream connected to this particular cost. So I think that's why it's oftentimes characterized that way.
Could I just add to that?
Sorry, please, Dr.
I would say the impact is today the students coming into college are lifelong learners. They're going to keep coming back to college. So we have a responsibility to make that investment. Secondly, now universities also are held to help our communities thrive. And these students are going to enter that community. So we have a much bigger responsibility from K through 12, through college, through beyond into the community. So addressing this issue in collaboration with all those entities is critical. So it is an investment.
When you're putting together a symposium, your one greatest wish is that your opening session will be perfect. And I think we have achieved that today. I'm so grateful, and on behalf of ACHA and all of our partner organizations, I want to thank Dr. Andrea Chapdelaine of Hood College, Dr. Ronald Nowacek of Frostburg State University, Dr. Troy Paino of University of Mary, Washington, and Dr. Venkat Reddy of University of Colorado at Colorado Springs for a really excellent and thought-provoking first session. Thank you.
Thank you.